Hello, this is a demonstration video on how to do an exercise progression, specifically with the goal of strengthening hip abduction and the glute med. This video will have a progression from both non-weight bearing and weight bearing activities, increasing in both difficulty, frequency, and complexity. These exercises are developed for a patient that would be experiencing a period of non-weight bearing or ambulatory help due to a tibial stress fracture, and then the progression moving forward from that stress fracture. The first exercise is clams, as demonstrated here. Clams are a great non-weight bearing exercise to work on strengthening the glute med. They can be performed at a beginner level without a band, doing roughly 10 reps per set, and you can increase the intensity by either adding more reps, more sets, or adding a band as demonstrated here. This next exercise can be started as soon as the patient is cleared for weight-bearing activities. The exercise shown here is side steps. At a novice level, side steps can be performed without a band. As the patient progresses, a band may be applied to add additional resistance. To make the exercise even more difficult, the band can be moved down towards the ankles. By moving the band further towards the feet, the exercise becomes more difficult for the patient. You can also increase this by increasing the number of reps, the distance in which the patient sidesteps, or the number of sets. Another great exercise to incorporate is a side plank. When the patient is still in a non-bearing state, side planks with knees bent as shown here can be very effective in engaging both the hip abductor muscles and the core. The exercise can be made more difficult by straightening the legs out, engaging more core and the glute med. The exercise can then be progressed even further to include abduction of the opposite hip. You can make these more difficult by increasing the time, the number of sets, or adding in other dynamic movements. The next exercise, while not specifically including hip abduction, is a great engager for the glute med. During an RDL, or a Russian deadlift, the glute med needs to engage to keep the pelvis stable. Here, we have a demonstration of an RDL occurring. As the patient goes down, they must engage the hip abductor muscles, specifically the glute med, on the side that is making contact with the ground. To make this more difficult, a patient can use a dumbbell, a kettlebell, or a resistance band as shown here. Again, with all other exercises, making sure form is your number one priority is highly important when doing a complex movement such as an RDL. You can increase the difficulty by upping the weight, the number of reps, or the sets. Thanks for watching our video. I hope that these technique demonstrations were informative and that you now have a better understanding of how these exercises can be used to increase hip abduction strength, specifically targeting the glute med, and how these can be progressed with a patient who may start off with non-weight bearing restrictions and can progress through to a more functional athletic activity. Again, thank you for taking the time to watch these videos. I hope that the information was informative.